questions of your social pharmacy. So basically what you have to do, you just have to uh, watch this video in a very we can say passionate way, or we can say in a very honest way. Don't try to skip any topic because the any questions, because the question that you are going to skip is coming in your examination. So with this motivation, like if you are going to skip any topic in today's discussion, that is going to become in your tomorrow examination. So dear student, you just have to boost your basics, you just have to clear your points in this 30 questions. I am just clearing your 30 concept. So all of you have to clear with your concept, you have to do the work in a very dedicated way. Got it? So first question, welcome to model paper. First question, like the uh, National Urban Health Mission, focusing on improving the health service in which area? So basically, the National Urban Health Mission, like we have the National Health Mission, that is further divided into two types. One is National Rural Health Mission and National Urban Health Mission. So these are the four area: rural, urban, tribal, and coastal. So, dear student, I don't think like is there any need to think about this question. You are able to see urban is there and urban is there. So this is the right answer. As I told you that National Urban Health Mission, specially focusing on the healthcare services in the urban area. So urban area that are having the health challenges due to the improper we can say improper condition, improper equipment, resources that we have. So basically according to this we can say a mission, but we are trying, we are just providing the we can say adequate supply of food, adequate supply of equipment, adequate supply of health needs. And like the health challenges, like we have like population density, like the people from the rural area are migrating to the urban area for their income, for the more resources. Next, like urbanization means like the person that are moving from the rural area to the urban area, and that leads to inadequate infrastructures, and healthcare needs are also not there. So National Urban Health Mission, this is the logo that is launched by our government of India, like Rashtriya Swachhta Mission. And second question for you, like which of the following dimension is not included in your WHO definition of health? So WHO definition of which of the following dimension is not included in your WHO definition of health? So definition of health, we have the option, like we have the occupational, okay, spiritual health, well-being, okay, physical well-being, and mental well-being. So according to our World Health Organization, if a definition of a good health is like a personal that is physically, mentally, and spiritually well-being, is the definition that is given by our WHO, that is World Health Organization. So occupational well-being is not a definition of your health. So we have some dimension that are basically related to, or we can say health, that we have the various aspect of the health, like a person that is remain physically healthy, uh, mental health, and social health, as well as the spiritual health is also added in the definition of health by the WHO. As there are many research publications and many research are going on that spirituality, like Hindu prioritism, Muslim prioritism, everyone have their own spiritual knowledge. So spirituality can somehow decrease the mental stress, can increase the physical efficiency of particular type of patient that is having any type of disease. So spiritual health is also we can say prioritize their spiritual well-being. And social health, like how we can behave in our surrounding, what are the attitude of thinking we have, what are the culture, economic, education background we have. Next we have which of the following is the scope of social pharmacy? So social pharmacy basically having the source medical product, vaccines, technologies. Next you have leadership, governorship, health informations, health services, and health finance. So these all are the scope of social pharmacy. Basically social pharmacy dealing with the uh, definition, explanation, comparand, and modified practice that is used by scientific method to help the person. Or we can say social pharmacy, that is basically research to own and objective we can say to look at the any issue topic that is related to the prescription of drug use in the pharmacy operation. So it is a hybrid field that examines every facet of pharmacy practice by combining the theories and approaches from other humanities sociality. So due to multidisciplinary nature of our social pharmacy, we have to broad up the academic field as well as we have to improve the research and development methodology to find a good solution for the human health. So the field like our social field, social, psychological, psychology, political science, educational studies, your communication, economic, history, and anthropology. So these are the fields that are basically related to your social pharmacy. Next question for you, like which federal agency is responsible for regulating and approval of newly prescribed drug in United States? So we have to find the regulatory authority that prescribe that regulating the medication, that regulating the approval procedure of the prescribed medicine. So first option we have like Center of Disease Control and Prevention. No. Next we have National Institute of Health. No. Next, we have USFDA, United States Food and Drug Administration, that is the approval authority that is given to approval for the new prescribed drug. So, Center of Disease Control and Prevention. The main goal is the protection of the public health and safety, the control and prevention of the disease and injury and this disability of the US and worldwide. Next, you have the National Institute of Health, that commonly referred to the primary agency of your United States government that is responsible for the biomedical and public health research. After that, you have the US FDA, means United States Food and Drug Administration, that is the federal agency that is responsible for regulating and approval the new prescription drug before they can be sold to the public. After that, we have the WHO, that is World Health Organization, is a specialized agency that we can say United Nations that is responsible for the international public health. Like we discuss about the Indian Drug Regulatory Authority, we have the CDSCO, Center of Drug and Standard Control Organization, that is the Indian Regulatory Authority. After that, we have the next question like how many sustainable development goals were established by the United Nations? So, how many sustainable goals are developed by your sorry developed by your SDGs? SDGs, that is basically your sustainable development goal. SDGs define your sustainable development goal, and SDGs is having the they can ask the question like what is the full form of your SDGs? SDGs is having the full form Sustainable Development Goal. Sustainable Development Goal is the full form of your SDGs, and but that is established by your United Nations, and we have the 17 Sustainable Development Goal that were established by the United Nations. So these are the list of the 17 establishment goal, like they want, or we can say according to Sustainable Development Goal. No, we just have to eliminate poverty, zero hunger, good health and well-being of the human, quality education we have to provide, gender equality we have to give, clean water and sanitation, affordable clean energy, decent work and economic growth, industry, innovation and infrastructure, reduce inequality. We have the sustainable cities and community, responsible consumption and the production, climatic actions, life below the water. We have to see the aquatic life, life on the land. We have to we can say maintain the resources that we have. We don't have to use, or we can say we don't have to overuse the resources that we already have. We have to we can say look at the matter of peace, justice and strong institutions and partnership for the goal. Also, these are the 17 goals that are developed by our sustainable development goal. So next question for you guys, which of the following is the dimension of the health? So as I told you before, the health include your physical, mental, social and spiritual health. So this is the option that all of these basically dealing with the health, that is physical, mental and social. So these are the dimension of health, like Physical health, like a person is having the physical integrity and both structurally and functionally. Mental health means a state of balance between the individual and the surrounding world, and a state of harmony between own self and the other. A state of balance between the individual and the surrounding, a state of harmony between one and other self. Social health means it is a result of not only receiving the medical care but also society total integrated growth, including its culture, economic and educational, social and politics aspect. After that we have the spiritual health. Spiritual health, like we have the Hindus prioritize their spiritual well-being above all as, and a approach health is influenced by your supernatural force, or we can say oldest Indian medical system Ayurveda that hold the social cosmic force regulating all the living things. Next question for you: which of the following is not considered a determinant of the health in social pharmacy? Which of the following is not considered a determinant of of health in social pharmacy? So genetic predisposition, okay. Social economic status, okay. Access to healthcare is healthcare service, okay. Age is there. So age, that is not considered a determinant of the health in a social pharmacy. We cannot say like if a person is having this age and he or she will remain happy, because today's time there is uncertainty, because the children we can say neonatal are also unhealthy. Children, we can say adult, or we can say younger, um, upper adult, and we can say elder, all age are having the health issues. So genetic by genetic prediction, predisposition, by socio-economic status, by access of healthcare service, we can consider that this is the way, or we can say determine the health and social pharmacy. So genetic, like one of the cause of several disease is hereditary, and some type of illness are caused by your hereditary trait that people inherited from their parents. Life cycle, we have the environmental factor, we have like socio-economic factor, like what how you are behaving with your society, and if you are living in a society, are you having the introvert nature, or we can say extrovert nature. So being a student of GDC and being a student of me also, so you just you don't have like extrovert and you don't have to introvert, just you have to balance. As previously, like the resources topic we have, so we have to balance the resources that we have. Next we have the political will. Political means like a poverty, that is main contributor to poor health, and can be seen if we can examine the cause of health illness. So disease agent that target the underprivileged population that residents in the slum with low hygiene condition. Availability. Availability of healthcare services. It is now widely acknowledged that the right to the health is a fundamental one. Therefore, it is in each nation best interest for its citizen to be a good health. Each country government offer a cheap health product to every citizen in their locality. Next question for you, like which factor is most closely associated with the medication adherence and the compliance? So you just have to find the factor that is mostly associated with your medication adherence and your compliance. So socio-economic status, health literacy, cultural beliefs, and accessibility to the healthcare services. Accessibility to the healthcare services. So you have like so socio-economic status, like it is mostly closely associated with your adherence, or after that we have the health literacy, cultural behalf, accessibility of the healthcare services. So being a good human being, you have to make the balance, you have to make the balance in all the things, like you have to make the balance in your daily schedules, you have to plan your day in a very productive way so that you can take more and more time for your productive hours. You just can take that today only you have to read and write, and like when I was in my childhood, and my mother was saying like You don't have to skip this spirituality, and if you are going to spirituality, it is like a bad thing. So if you are going to miss any classes, miss any we can say topic, so it is a very bad thing, and God is not going to give you the relief. So you have to clear the concept in each and every class, and you have to search, like, if you have so much of content that you have to prepare, then from that you just have to find out the best on best. You just have to find out the best on best, the topic that you have, and you have to give your best. So from the many negative point, you just have to find out best on best. From so many negative point you have, you just have to find out the best on best among them point. Got it? So, we have the most closely associated medication adherence and compliance, like the healthy literacy. Health literacy is our most closely associated with your medication adherence and the compliances. So, health literacy, that is play a crucial role in medication adherence and compliances. The individual with the higher health literacy are better able to understand the medication instructions and the adherence to prescribed doses form, and recognize the potential side effect, and compare the importance of medication adherence in managing their health condition and effectively. So they are also more likely to communicate effectively with the healthcare provider about their medications, leading to improved medication adherence and the better health outcomes. So health literacy, that is very crucial for being a we can say medication adherence and the compliances that the individual have. After that, we have the next question, like according to NHP, that is National Health Policy, what is the target of infant mortality rate by the year of 2025? So by the year of 2025, we want, like, infant mortality rate is around 25 per 100 live birth. So you just have to remember this point. And like infant mortality rate, that is having the full form IMR. They can ask the full form of IMR. That is 25 per 1,000 live birth by 2025, and a significant improvement in the infant health outcome compared to the previous year. As our India is a developing country, the resources that we have, infrastructure and medical sciences that we have, are developing day by day. As you know, like we have a previously, like a few years before, we have only 7 aims all over the India, but the government of India, we can say, we can say Modi government has launched 22 all India medical hospital all over the India. We have 22 aims all over the India. The infrastructure, and we can say the because equipment accessories are like very good. So we have to improve and access the material, child health care, enhancing the prenatal neonatal care, promoting the immunization. As you know, like before, we can say a few years back we had the COVID-19 pandemic. So at that time, the India has, we can say, government of India has launched the vaccines, that is COVID, Covaxin, that is given to each and every young patient, younger we can say person in the country. And we just have to address the socio-economic determinants of the health. Next, you have, what was the primary objective of the Millennium Development Goal (MDGs), and what are the primary objective? So, Millennium Development Goal, to eradicate poverty and hunger. Okay, and next you have to promote the global health and well-being. Okay, to address the climatic changes and environmental stability. Okay, next you have to achieve the gender equality and empowerment. So we have the Millennium Development Goal, like to eradicate the poverty and the hunger. So they can ask the question like this, like MDG, that is your stand for your MDGs, stand for your Millennium Development Goal. The goal was saying, according to goal, like we have to eradicate poverty or hunger from the country, and it was established by the United Nations in the year of 2000, and as a framework for the global development and poverty reduction. Next, you have which framework aim to guide the global efforts toward the sustainable development, including the health by the 2030. So, which framework aim to guide we can say global efforts toward the sustainable development including the health by 2030. So this is by your sustainable development goal, as we had discussed. So according to goal, we are aiming to uh, doing the global efforts for their sustainable development including the health sector also. So SDGs, that is Sustainable Development Goal, that basically aiming to guide the global efforts toward the sustainable development, including the health by 2030. Next question, like what is the primary focusing for the FIP, that is International Pharmaceutical Federation Development Goal? So uh, International Pharmaceutical Federation Development Goal basically discussing on the strengthening pharmacy education. So it is very good for us, like we are from the pharma background, and there is like something policy we have, that is International Pharmaceutical Federation, that is basically focusing on the strengthening the pharmacy education throughout the country. So International Pharmaceutical Federation development goal is having the goal to strengthen the pharmacy education globally, and the global federation representing the pharmacy and pharmaceutical sciences recognizes the importance of educations in advancing the primary profession, ensuring the competency of the pharmacist and the improving the patient care outcomes. Next question we have, which of the following is not a component of social determinant of the health framework? So health framework, we don't have the outcomes, like healthcare system efficiency is not a component of the social determinant of health framework. The social determinant of health framework typically include the component, the social development, social determinant of health framework typically include the components such as you have socio-economic status, educational level, your neighborhood and physical environments, social and community context you have, employment and the working condition, and next you have the access to the health care and availability of the resources that you have. So the social determinant of the health framework typically include your socio-economic status, educational level, neighborhood and physical environment, social and community context, and employment working there, and the accessibility of their health and availability of the resources that we have. So which of the following is not is considered as an indicator? Which of the following is considered a health indicator? First, we have the economic level, educational attainment, life expectancy, okay, access of the transportation. So, access of the transportation, I don't think. Educational attainment, I don't think. Economic level is not considering the health indicator, but the life expectancy is only the key indicator that measure like average number of person in a year, or we can say expected their life from the birth to the death in a specific population. It provides the insight that overall health and well-being of the population, like from the birth with a specific population, from the birth till the age of old. So life expectancy, like same we have the expectance. Expectations mean just I want to purchase a whose we can say I want to purchase Apple phone, Apple mobile phone. I want to purchase MacBook. I have expectations like I just want Domino's pizza. I just want McD burger. I want to visit in the Himachal. I want to we can say stay on the Marine Drive. I want to go for a beach party. So these are the expectation we have, but we have to balance the expectation. We just have to down our wants. The wants that we have to down. If you have not a want, then you will remain happy throughout your life. So please down your wants. It doesn't mean like you just down your wants like, sir, we don't want government job. So that is not your bad want. It is a good want, and for that, for your want, if you have like other want also, for that you have to do the work. If you are eating unhealthy food like the McD burger and Domino's pizza, for that you just have to add more good food as well. You have just have to do the physical exercise. Next question for you. FIP consists of which board? FIP, that as I told you, that is basically concerning with the board of your pharmacy and we can say pharmaceutical practice. And we have the board of pharmaceutical practice in the science. FIP, as I told you, that is basically the board concerning with the scientific as well as the we can say pharmaceutical practices, and it is the stand for your international pharmaceutical federation, that is basically three area like science, practice and education. So pharmaceutical sciences, pharmaceutical practices, educations, they are basically doing a collaborative work with FIV vision and the missions. They have specific missions like they just want the pharmacy profession to be upgraded. They just want a equal regulation of the education throughout the country, and they just want that the uh, new innovative drugs should be invented by the pharmaceutical field. So, required number of population to establish PSC in a plain area. PSC in a plain area, number of requirement of population, required number of population to establish the PSC, that is primary health service or become community. We have to, there is a requirement of population, we have requirement of 30,000 to establish the primary health center, primary health community. According to National Health Mission, there is a need of over 30,000 of population in the rural area, whereas 20,000 in the hilly, tribal and desert area. So if you want to establish a PSC, you should have the 30 plus, or we can say 30,000 of population in your locality if you are from the rural area. If you are from the hilly areas and tribal and desert area, you have the population of, we can say around to 20,000, so that you can apply for the primary health center according to your National Health Mission. So we have the center like the sub center we have, and there is a limit for the plain area that there is 5,000 people, and for the hilly area there is a requirement 3,000 people. And for the primary health center, there is PSC, there is a requirement of 30,000 in the plain, 20,000 in the hilly. Community health center, there is a requirement of 1 lakh, there is a requirement 1 lakh 20,000 in the plain area, and in the hilly and tribal area, there is requirement of 80,000. Next question for you, like full form of CSCS. CSC, that is your community health centers, that are basically the private and we can say non-profit organization that provide the medical facilities and services, and depending on the involvement and the impact of the consumer. So CSC, that is the community health service centers that usually offer the people in the medical insured and underinsured or lesser income group with the primary and preventive care. So next you have like which of the following is the role of pharmacist in the public health care. So being a pharmacist, you also have to know the role of pharmacist, and you have to we can say give your best in the role that is assigned to your respective authority. So being a pharmacist, we have the role in reviewing the prescription, we have a role in counseling, patient counseling and dispensing of the medications. So pharmacists play a very crucial role in public health system, and their responsibility extended beyond the simply dispensing medications. So that is like a role of dispensing the medication, but it is not like just we have the only work to dispense the medication. Being a pharmacist, you have to review the prescription, you have to do the patient counseling and dispense the medication as usual. You have to do the medication management, like you have to provide the essential medication on the particular time. Vaccination services you have to do, medication therapy management you have to do, health and promotion, education you have to provide, screening and monitoring of the particular patient, emergency care you have the condition you have to know the use of we can say emergency medication, and you have to a specific information about the resources of the drug and their side effect. You have interactive sessions with the public health and medication safety. You have to watch these all the things. Next, we have like cleanliness, physical exercise, and rest and sleep are a part of. Cleanliness, physical exercise, rest, and sleep are a part of your personal hygiene. Because if we remain clean, we will do the physical exercise, We can rest and we can sleep. So it means these are our personal hygienes. We have to balance, we have to upgrade the personal hygienes, we have to remain so much cleanly, we have to take live in a proper we can say we have to wear a comfortable cloth, we have to live in a proper habitat. Healthy diet, rest and exercise are also the basically involved in a personal hygienes. So for you have to wash your clothes with the soap. Shower you have to take daily. You have to washing your hand daily. You have to wash your we can say washing your this and untils daily. You have to wash your hairs with using the shampoo and we can say serum that you have, conditioner you have. You have to brush the teeth twice a day. Next question for you. Which of the following factor is necessary for a healthy person? For a healthy person, there is a necessary condition like for a healthy person, it should have a vaccination, balanced diet, and personal hygiene. He or she have to take. Factors that are necessary for the healthy person are follow like a clean environment with the proper public health system like the personal hygiene for prevent an infectious disease. A proper balanced diet and a sufficient nourishment are necessary for the good immune system for your body. Immunization against the various diseases that we have, like it's about the chicken pox, hepatitis, measles, mumps, rubella. So all vaccination should be given to from the birth to till the uh, life period. Staff at PSC include PSC, as I told you, primary health center. So there is a requirement of pharmacists to dispense the medication, to do the patient counseling, provide the medication. There is a staff of clerk to manage or to do the we can say office work. There is a need of laboratory technician to do all the tests and availability of the equipment. And this is the all of these. So this is the staff pattern in the primary health center. There is a one medical officer, one pharmacist, one nursing officer, one health worker that is female, that is ANM, one block extension educator, one is your health assistant that is female, that is LHP. So Millennium Development Goal by 2015 includes. So we have the Millennium Development Goal by 2015 that include to reduce the child mortality, to improve maternal health, to de develop goal partnership. So we have the 8 Millennium Development Goal by the we can say 2015 just to eradicate the extreme hunger and the poverty from the country. After that we have to achievement a universally primary educations, then promote the gender equality and empowerment. After that reducing the child mortality, improving the maternal health and combat of HIV, AIDS, malaria and other disease, ensuring the environmental sustainability, global partnership of and the development. So identify the factor which are responsible for the health. So we have the external environmental factor, genetic inheritance, and the social support system. So all the options that is given in this question are very good, or we can say these are the factors that are responsible for a health. How they are responsible for a health, or we can say how we can encompass a broad range of influence. So external environment like this include physical social condition where the individual lives such as the housing, pollutions and community resources. Genetic inheritance like can predispose individual to certain health condition influencing the overall health status. Genetic inheritance. After that we have the social support system like the presence of the supportive network of the family, friend and community can be significantly impact mental and physical health. So social sport system like the presence of the sportive network of the family, friend and community can significantly impact the medical and physical health. Like the characteristics of the mental health are like we have the self satisfaction, adjustability we have to maintain for being mentally healthy, and self control. Self control is like that if someone is shouting on you, you just have to control. You have to you just have to take a good quick decision. It is not like someone is shouting on you and the same process you are repeating on them also. Self satisfactions mean like the resources that you have to good we can say you have to give your best. You have to satisfy with the eating habitat, you just have to satisfy with your clothing and all the things. Adjustability means like we have to adjust the changes and challenges in our life. We have to accept and we have to reliance, and there is a flexibility in the resources, or we can say changes that we have. So these are the character that is given below for the mental health, and they are attribute for a strong contribution toward the psychological well-being. Like the self-satisfaction, we can say a sense of contentment with the own self and one life circumstances. Next, you have the adjustment, like the ability to adapt to change and changes in the life and demonstrating the reliance and flexibility. After that, self-control, that is the capacity to regulate the emotions, thought, and behavior effectively. So these are the three character that is basically composed for a mental health, like self-satisfaction, adjustment, and the self-control. So when was the National Herbal Health Mission approved by the cabinet? So as I told you, National Health Mission, that is basically contributing our two mission, like National Rural Health Mission, National Herbal Health Mission. Health Mission basically leading to the development, providing the healthcare needs to the urban area, and this was approved in the year of 2013 and in the on the 1st May. So National Herbal Health Mission was approved by the Union Cabinet of India on 1st May 2013, and it is a sub mission, as I told you, under your National Health Mission, and that is as I told you, it is specifically focusing on the healthcare services in the urban area. And we have the challenges that population density, rapid urbanization, inadequate infrastructure, disparities in the access and health service. So according to the WHO, mental health is more than just the absence of. WHO says that health, that is more than just the absence of mental disorder. So mental disorder is more than just the absence of mental disorder. Mental health is more than just the absence of the mental disorder. Like WHO, that is World Health Organization, that is focusing on the mental health or the state of well-being when the individual cope up with the stress of the life and realizing their ability to learn and work effectively and contribute to their community. And this define the highlight that the mental health is a complexing continuum, and not merely the absence of mental health condition. Got it? So next question for you, like which of the following is not one of the sustainable development goal? Which of the following is not the sustainable development goal? Or they can ask like what the SDGs stand for. SDGs stand for, that is sustainable development goal. According to this goal, there is a we can say there is a uh, it include like zero hunger, it include equality in educations and gender, it include the clean energy of for all. But global eradication of the pharmaceutical is not included in your sustainable development goal. So in sustainable development goal, it is not included your global eradication and your pharmaceuticals in your pharmaceutical development. So uh, next question for you. Uh, just we are remaining with the 2 to 3 questions, so we can try to compile. As you know, like this is around 40 minutes that we had done. So which of the following is not a commonly used health indicator? So health indicator we have, or we can say we have the health indicator like life expectancy, as we had discussed previously in the last question. Next we have the disability and adjusted year, like DALYS. Next we have the infant mortality rate, and but your GDP, that is gross domestic product, that is not include in your health indicator. GDP, that is your gross domestic product, that is no is not a common use, we can say, in health indicator. So GDP, that is gross domestic product, it is a measure of the economic performance of the country, and it represents the total value of good and services provided with the country, and it broader over a specific period, typically a year. So GDP, that is contributing the total values, all the goods and services that we are required for a wealthy health being. So they can ask the full form of GDP, that is gross domestic product, that measure the economic performance of the country. Next question for you, which health indicator focus on the number of year lost due to premature death before a certain age, often set at 75 year. So which health indicator, that is basically focus on the number of year lost due to premature death before the certain age, often set at 75 year. So we have the year of potential list loss, life loss expectancy, that is known. We have life of potential life lost, YPLL. So they can ask the, like, these three are important. It doesn't mean like this is the right answer and you just have to remember this. You have to remember this full form also, like what is DALYS stand for? Disability adjusted life cycle. Next you have QALY stand for, that is quality adjusted life cycle. So you have to remember all these three full form. This is very important. What is YPLL? What is DALYS? What is QALYS? So next you have the year of potential life lost. So year of potential life lost is the health indicator that measure the number of year of the life lost due to premature death before a specific age, and often it is set around 75-year-old. It quantify the impact of premature mortality on overall population health and longevity. So this is very important. So dear student, this is the last question of today's model paper first of social pharmacy. So which of the following is not one of the sustainable development goal? Which of the following is not a sustainable development goal? As I told you, we have the 8 sustainable development goal. Gender equality is there, quality education is there, economic growth is there, nuclear proliferation is not the goal according to the sustainable development goal. So you have to remember all the sustainable development goal from the last slide also, like nuclear proliferation and spreading of nuclear weapons is not one of the sustainable goals. We have the goals like gender equality, providing of vaccination, education pattern, immunization, all are the sustainable development goal as we had discussed the 8 earlier. While nuclear disarmament and non-proliferation efforts may indirectly contribute to the peace of the security, and it is not explicitly listed as a separated goal among the SDGs, that is Sustainable Development Goal. So dear student, we had done with the model paper first of social pharmacy, in which we had discussed the top 30 question of social pharmacy. So you have to remember all the concept that I had discussed in the slide, and you have to do the revision on daily basis. Try to watch more and more videos like this. Try to attempt more and more question paper. Try to watch more and more videos, test series. Ask your doubt with directly with us. So thank you everyone for this session. We will meet soon in next session with next model part. That's model part second. So all the best for your examination. Thank you everyone.